And good morning to all. It's a tremendous honor to take part in this conversation. I am here representing Mayor Libby Schaaf. And my name is Guillermo Cespedes. My title is Chief of Violence Prevention for the City of Oakland. The City of Oakland created my background for many years, for 4 decades, has been in social prevention. But the City of Oakland has created a department, a position that it's at the same level of the chief of police. So part of my mandate is to help the city of Oakland establish a violence prevention approach that includes some modifications to the structural policing. This was before the pandemic. Now this has become even more accelerated. The city of Oakland, I'm just going to share a few reflections about the city and what we're doing and add to the conversation that way. The city of Oakland is a small city in Northern California of roughly less than 500,000 residents, but with a very high homicide rate of roughly 17.5 homicides per 100,000 residents. It's a very diverse city, equally divided between African Americans, Latinos, and Asians, and of course, white Americans. And with a long, deep-seated history of social action. The city of Oakland is the birth of the Black Panthers in the United States. So it kind of represents, while it's a small city, represents a really good illustration of what's happening across the country. My particular experience is that I do work for the city of Oakland, but I also coordinate with Los Angeles, where I used to be the deputy mayor, with the city of Chicago, with New York. So we're in essence part of this movement that now has a mandate that urban areas are really driving national public policy, as is happening in other countries. The city of Oakland has established a public health community-driven approach to violence reduction. And the community-driven, it's more than a title. I think that it's the first city that I've worked in where the level of community input, it's absolutely essential to everything the city does. This is a historical moment in which all of us, all of our colleagues on this call are struggling with this concept of reimagining public safety. One of the things that we have discussed in the city of Oakland in a very robust way is that all of us in city, local, state, and national government have been a part of the problem. We have been a part of the problem that has led to this situation that we're in with law enforcement. It's been, of course, exposed by COVID-19, but this was not created by COVID-19. And like many other cities, like it was presented in Chile and in Bogota, it is not surprising that the areas with a history of higher forms of violence, social violence, are also the areas that tend to be the geographic areas that tend to have the highest rates of infection, COVID infection. In the case of Oakland, I am responsible for establishing a place-based approach, which includes 9 of the 52 police beats throughout the city that account for roughly 52% of shootings with injuries in 2018 and 2019, and roughly 28% of gender-based violence in both of those years. As I said, it is not surprising that these are the same areas with the highest rates of infection, ranging between 300 and 400,000, 400 residents per 100,000. 30 to 40% rate of infection per 100,000 residents. This is not surprising, as you all know, because it is the underlying historical inequities, which does include structural racism, that have created the same conditions that have produced violence, social violence, specifically violence associated with groups or gangs, that is creating this absence of adherence to the mitigation of COVID. In fact, I think we do need to re-examine, all of us, whether the norms established for social distancing are in fact culturally congruent, meaning that they by themselves represent a sector of the community that can actually practice social distancing. The families that have 5 members that live in a 3-room apartment, that practice does not, it's not relevant to their lives. So the other issue is that I think it is a time that we do have to acknowledge that a really profound problem is the absence of credibility that those of us in city government, state, and federal government have with certain communities in the United States, primarily African American, Latino immigrant communities, and others. So we've established a task force to really—
1 minute, please, maximum. Thank you.
We have established a task force to go through a step-by-step process of restructuring what we think of as public safety. And this task force will, I am a member of the task force, and we will have to publish, we're scheduled to publish a report by October 1st. What the citizens of Oakland are mandating is minimally a 50% cut in the police budget, and having those funds be distributed in social programs. I would like to close with the following. I see this historical moment as a great opportunity to really reconceptualize not just law enforcement, but our concept of public safety as it relates to public health. For many years, many of us have been saying that social violence is a contagious disease, but that hasn't been taken seriously because, in fact, you could have violence in one part of the country and the rest of the country is not impacted by it. What COVID-19 has done is that it's brought to the surface that in any city, if there is 2 or 3 people infected, the rest of the city is actually at risk. So it is a moment in which it's going to require tremendous coordination between city, county, state, and national government, led by community-driven voices. I think that we have to acknowledge that we have left certain communities out of the dialogue, and this is a time to re-include them in their interaction and really listening to their points of view rather than our point of view as government. I look forward to questions, to dialogue, and again, thank you for allowing the City of Oakland to have a voice in this important dialogue.